Welcome to Ask More TV. We're here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is food allergies and digestive problems. What food allergies can cause digestive problems?
Well, food allergies by definition are foods that have evoked an abnormal response in combination with one's immune system. Virtually any food can cause digestive symptoms. Common foods that might cause digestive symptoms that are from food allergies would be a food allergy to gluten, which is found in barley, rye, oat, and wheat, for example. There are other foods. And also, a person may have an allergy to dairy products or to corn or to chocolate. So these are very common, or citrus foods. These are the most common types of food allergies that can cause gastrointestinal problems.
Is a food allergy genetic?
Food allergies usually are genetic, or at least they're thought to be, meaning that a person is genetically predisposed to their immune systems reacting adversely to a food that's consumed, which should be distinguished from a food that a person might consume that might create digestive problems but may not actually be an immune-related allergy. In other words, a person could have a lactose intolerance. Lots of people have heard of that, where they might eat dairy products or drink a glass of milk or have a food that has dairy, and they might develop diarrhea or gas or bloating. But that's not a food allergy. That's an enzyme deficiency. So these people would take lactase, which is the enzyme which helps digest the milk sugar lactose. So we want to distinguish between food allergies, which may be genetic, and then also enzyme deficiencies like lactase enzyme deficiency that's involved in lactose intolerance, which is also genetic. But a person could develop what seems like food intolerances over the course of their lifetime. So, said another way, food allergies are genetically predisposed, but over time, as one ages, a person could actually develop genetic food intolerances.
If a person is born with a food allergy, can they ever outgrow it? And how does a person who has never had an allergy before develop one during their adult years?
Many people have experienced having known food allergies, and then all of a sudden, one day in their lives, they're able to tolerate the food. So yes, a person can outgrow a food allergy, and a person might also develop allergies later in life. But often, allergies can be confused with enzyme problems. As a person grows older or has stress or is taking certain medications, their bodies might not produce the same amount of digestive enzymes all the time. So they might get gastrointestinal or other symptoms of food allergies when it's really an enzyme deficiency, which is not a food allergy. But yes, a person can outgrow food allergies, or they can develop food allergies later in their lives. Absolutely.
Are there any preventative measures that one can take to avoid the development of a food allergy? What other treatments are there once someone has been diagnosed with the allergy?
Well, once you know that you have a food allergy, the only real treatment is to avoid that food allergy. If you avoid the food long enough, sometimes certain individuals can reintroduce the food and they might be able to tolerate it fully, or at least some amount of it. So in other words, food allergies are not always all or nothing, meaning you have the food and it creates an adverse symptom. That symptom might happen only when you eat a certain amount of the food or a certain type of food. So, for example, if someone has a dairy allergy, they might have a dairy allergy only to, let's say, a piece of pizza they might eat, but they might not have a dairy allergy to yogurt. So the preparation of the food, the combination of the food with other ingredients might affect how someone develops food allergies and can tolerate food allergies.
This has been Dr. Michael Wald.